newborn baby can look completely healthy at birth, breathing, feeding, and with no visible signs of illness. But sometimes, their condition can decline rapidly within hours or days, and this can lead to a life-threatening emergency. What makes it especially dangerous is that symptoms are often very subtle, meaning that even experienced doctors can miss them at times. So how can an infection progress this quickly inside of a body that just began adapting to life outside the womb? And what exactly happens in the body during neonatal sepsis? So what exactly is neonatal sepsis? Neonatal sepsis is a serious bloodstream infection that affects newborn babies during the first 28 days of their life. And this means that it's unlike a localized infection that affects one area of the body. Sepsis involves a systemic response, which means that both the infection and the immune response affect the whole body at once. The danger not only comes from the bacteria themselves, but also from the immune system's response to these bacteria. When bacteria enters the bloodstream, the immune system releases signal molecules to fight the infection. However, in babies, this response can become dysregulated. Instead of staying controlled, the infection spreads throughout the body, meaning it affects blood vessels, circulation, and multiple organs at a time. This is why neonatal sepsis is considered a medical emergency and why treatment often begins before laboratory confirmation is available. Doctors often classify neonatal sepsis into two main categories: early onset neonatal sepsis and late onset neonatal sepsis. The timing matters because it determines where the bacteria came from and what type of bacteria it most likely is. Who does it affect? Neonatal sepsis affects infants, but some groups are way more high risk than others. One of these groups are premature babies. This is because their protective systems are much more vulnerable and less developed than other babies. Their skin barrier is thinner, their lungs are less mature, and their immune system is not yet fully functional. Low birth weight infants are also more at risk because they're weaker and more medically fragile. Babies who require intensive care after birth are another high-risk group. This is partly because they require invasive procedures right after birth. For example, intravenous lines, feeding tubes, or mechanical ventilation. All of these three provide pathways of bacteria to enter their bodies. Even healthy full-term babies can develop sepsis if they're exposed to bacteria during delivery or shortly after birth. One of the most difficult aspects of neonatal sepsis is that its symptoms are very vague and non-specific. Some symptoms include poor feeding, reduced activity, unusual sleepiness, temperature instability, and irritability. These symptoms can easily look like normal newborn behavior. Over time, symptoms get more severe. Babies are going to have trouble breathing, or their breathing rate is going to be much higher. They might turn a little blue, and that is because less oxygen is delivered to the tissues. And their heart rates can increase or it can decrease, and their blood pressure may fall. In severe cases, this can lead to septic shock, which means circulation is unable to adequately support the body's organs. It occurs when blood vessels are too dilated and leaky. And as fluid leaves these blood vessels, circulation becomes less effective and the blood pressure can fall dangerously low. This reduces oxygen delivery to vital organs such as the brain and lungs, and without immediate medical intervention, organ systems will start to fail due to a lack of oxygen. And the main challenge here is that by the time that the symptoms are recognizable, already a lot of damage has been done, and this can be very dangerous. What are the causes for neonatal sepsis? One of the most common causes is a bacterial infection. Now, the type of bacteria will depend on whether it's early onset or late onset. For early onset neonatal sepsis, it's most commonly caused by E. coli, and this is transferred from the mother to the baby during pregnancy or delivery. For late onset neonatal sepsis, an example is certain gram-negative bacteria. There are many factors that increase the risk. For example, premature birth, premature rupture of membranes, maternal infection, among many others, and sometimes these factors are put together. Early onset sepsis occurs in the first 72 hours of life. This means that it's caused by vertical transmission, meaning from the mother to the child. And sometimes this can be unexpected as the mother was not diagnosed. Late onset, however, it means that it's caused by a contaminated environment, for example, hospital exposure for too long, and the bacteria can transfer to the child in these environments. Diagnosing neonatal sepsis can be very difficult because symptoms are vague and they overlap with other diseases. So, doctors first will order blood tests and blood cultures to identify any bacteria in the blood. Blood cultures are considered the golden standard because they can identify the exact organism inside of the blood. However, culture results take 1 to 3 days to arrive, and that is too slow to delay treatment. And for this reason, doctors use markers, for example, the C-reactive protein, also known as CRP. These markers help detect inflammation and help support early clinical decision-making. Complete blood counts can also be used to show abnormalities and white blood cell levels, although the results are not definitive. More recently, PCR testing is being used in hospitals to detect genetic material of bacteria much faster. However, diagnosis still heavily relies on clinical judgment and early recognition. One of the most challenging parts of neonatal sepsis is that treatment often begins before proof of the infection is there. And this is because the infection itself takes hours to progress, but tests take days to come in. Therefore, treatments like, for example, antibiotics are used much before the actual results come in. They don't need proof of the infection, they need to be fast because speed is important here. How is neonatal sepsis treated? Well, when the disease is suspected, broad-range antibiotics are used. These target the most likely bacteria. When lab results come back, antibiotics aimed at a specific bacteria may be used. Support here is required. They may use intravenous fluids or some breathing help, for example, mechanical ventilation. Hospitals should also use strict hygiene protocols to prevent hospital-acquired infections, and invasive devices such as intravenous lines should be carefully managed to prevent any infections. Neonatal sepsis remains one of the most serious medical emergencies out there. The combination of subtle symptoms and rapid progression makes it very dangerous. However, with early recognition and improved early detection systems and antibiotics, survival rates are increasing. Thank you for watching.